Hello and welcome to King Mash Show. Today we are going to be talking about obstetric ultrasound, and we are going to be checking on how to prepare for an obstetric ultrasound. Ultrasound, this is the ultrasound which antenatal or expectant mother or mothers who are pregnant are sent to do. And basically we are going to check what do I do when I'm going for this ultrasound. It really differs from the stage of pregnancy which you are in. Also in the future videos we shall be checking the types of ultrasounds that are done and at what age they are done. But basically, in all, the universal way to prepare for ultrasound: one, you should ensure you have weared comfortable clothing. Make sure you have worn comfortable clothing. Yes, by this, wear clothes which can easily expose your abdomen where the scan will be done. For those who don't like exposing their body parts, try wear maybe a dress that is different with the blouse so that you can only expose the abdomen where the scan is being done. By you wearing good dressing, it will make you comfortable when you're doing the scan and you won't feel embarrassed once you're told to change into a comfortable gown. The next thing you need to check do is empty your bladder maybe early before you go for the scan, and make sure you have taken at least 4 to 5 glasses of water. Take water. Take water at least 1 hour to the scheduled time of the scan. Why you take water is because you want to ensure when you're going for that scan, your bladder is full. You feel a bit pressed to the urine, because mostly when you want to do the scan, we prefer when you have a full bladder. So for the day that you know, or for the time you have been booked appointment, make sure your bladder is full. That can be done by taking at least four glasses of 250 mils of water. Maybe that's up to 1 liter of water, at least 1 hour before the time of the scan. Once you take this water, you'll save a lot of time when you're going for the scan, because by the time your appointment is due, then you'll be having a full bladder for you to do the scan. Other thing that you need to do when you're preparing for this, you need to understand the procedure, how it's done. You can do it through Googling or asking your obstetrician. You understand the procedure of the scan. So mostly the scans done for obstetric or for the antenatal mothers, or the ultrasound scans done for pregnant mothers, they are mostly external. They are done through transabdominal region. It's done on the abdomen externally, but in some cases you might end up doing the transvaginal, especially when the ultrasound is for very young fetus, maybe when you are around 7 weeks pregnant. Due to poor visibility of the features, sometimes they might do the transvaginal. But 90% of the time when you are doing the scans for pregnancy, we prefer doing the transabdominal ultrasound scan. The other thing, when you're understanding about the procedure, you should understand about the time it should take. Again, for the timing, it's very different according to the type of pregnancy. Maybe if you have a twin pregnancy, the time for scan could be a bit longer than if you're having a single pregnancy. Commonly, you see that when you're doing these scans, for the first scans, which you call dating scan, you'll find it will take around 45 minutes to 1 hour. As you advance, maybe when you're doing the anomaly scan, should take 30 to 45 minutes. And the ones for monitoring fetal well-being, you'll find them taking around 20 to 30 minutes. So also it depends with the stage which you are doing the pregnancy scan, at how many weeks are you. So you'll see the initial scans usually take longer because they are much smaller features, but as we go on, the scan gets more or less and less. We shall see timing for each other even as we cover the scan done at which and which visits. And lastly, and not the least, you should arrive to the place of scan at least 15 minutes before. So when you're given appointment for the ultrasound scan, please arrive 15 minutes before. Why you do this is just to reduce the anxiety and feel prepared for the scan assessment just before you get into the room. This will make you feel more relaxed when you're doing the scans, and maybe if there is a test or there is something you need to prepare a few minutes, like payment or something, before the scan is done, you are able to notice it and attend it before the scheduled time. And by this, you'll save both your time and the time for clients who are supposed to be scanned after you. Thank you so much for listening to this video. See you on the next one, when we shall be discussing about the dating scans, and also prepare for the other 3 types of scans and the stages which they are done. Thank you so much. See you on the next one.